It's International Nurses Day, a chance to say thanks for all their hard work. Instead, many working in hospitals are hit with fees at the boom gate with no choice but to pay up.
So we're paying $49 a fortnight.
I'm paying like $98 a fortnight.
$99 we pay every fortnight.
$87.
There are dedicated healthcare workers helping save lives during COVID-19, but it comes at a cost.
These are frontline heroes that are actually working so hard, extreme hours, under extreme conditions in this pandemic. The least we can do is make sure that they actually can travel home safely and come to work safely.
Every day they're being slugged high fees just to park at work.
This is a slap in the face to our hard-working frontline workers. This is not a time to make profits off other people's miseries.
We want to get to work safe, and to do so we have to pay the money.
Jessica Cowell's a registered nurse. She's charged a flat fee to park at the Royal Adelaide Hospital.
Doesn't really matter whether we park there once or 12 times in the fortnight. So long as we use it once, we have to pay that full $49.
She says she has no choice but to pay for parking if she wants to feel safe.
Where I work, there have been quite a few incidents. There has even been an incident in the car park where an individual was attacked by a patient or attacked by a member of the public. And there aren't the facilities to keep us safe.
So you've got these wonderful frontline workers who are going to work every day trying to deal with these health matters, and then on top of it, they feel like they're not being valued.
Ros Bates has been a registered nurse for 40 years. She's also Shadow Queensland Health spokeswoman and is calling for free parking for health workers during COVID-19.
We're seeing a lot more staff who are actually having to drive to work now because they're trying to avoid public transport and do the social distancing.
While we do fear for ourselves, we also fear for, spreading this to someone who is at risk, and that being on our conscience, and it's not something that we want to be doing.
Some states have stepped up. In New South Wales, parking at public hospitals is free. The Canberra Hospital is always free. In Queensland, staff at the Gold Coast University Hospital pay up to $10 a day, while workers at the Royal Brisbane are charged more than $90 a month. Health workers at the Royal Melbourne Hospital are being offered a discounted rate, while the South Australia Government has introduced a $100 monthly cap on parking fees. In Hobart, staff working directly with COVID-19 patients receive free parking, while others are being charged a discounted rate of $8 a day. Free parking is on offer in parts of Perth and Darwin too.
Why aren't we actually rewarding the health workers and caring for them?
Diane Asmar's secretary of the Health Workers Union. She believes government needs to act.
If we're all in this together, then I ask the state government right now, please provide free car parking for every single health worker.
Some councils in Melbourne initially gave a helping hand, offering free parking, but weeks later, frontline workers were given tickets. Luckily this time, it was only an official warning.
To make our money from our pockets, it's not fair.
Every year is getting expensive.
Health workers are now pleading for state governments and private parking operators to pitch in.
Everyone's sacrificing at the moment. Well, means a lot to me. It'll be helpful.
We're encouraging any private provider to offer a discount or free car parking. Anything they can do to support health workers in this difficult environment would be greatly appreciated.
Beth Moll's secretary of the Queensland Nurses and Midwives Union. She says we should be looking after our frontline staff.
They're the linchpin of the health system, always there, always vigilant, always surveilling and making sure that people are kept safe.
Adding insult to injury is the fact that a lot of car parks are privately owned. They are pocketing the profits, capitalising on the long hours worked by our health professionals in this time of crisis.
I think it's appalling that these private companies are profiting in this pandemic time.
But according to health workers, there's a simple solution.
That small gesture would say to our frontline workers, particularly our nurses, that we value you and we thank you and we care about you for caring about us.
Any concession would help right now. Some Sydney councils are offering free parking at facilities for frontline workers, while parking permits have been issued in parts of Melbourne.